healthcare and health in society. So as usual, normally the presentations will go for around 15 minutes with 5 minutes presentation time. But because this is the last session for today, because we have so few people, I'll let you get away with running through presentations for 17 minutes with around up to 8 minutes question time. So if you run out of questions within the 8-minute period, we'll just move on to the next presenter. So as usual, I will hold up the signs. 5 minutes left, 2 minutes left, and when this buzzer sounds, time up. So I literally have to stop you at the 17-minute mark. Okay, so first up is Chido Mwaturura, and her topic is going to be on current social structures and clinical depression. Take it away.
Okay, hi. So, as I get introduced, my name is Chido Mwaturura. I'm studying biomedical science, and the topic I'm doing is about current social structures and clinical depression. This is not really related to my study, but you will see that it is sort of related, and it was just a topic of interest. So, what we aim to do today is explore the links between social environment, chronic psychological stress, and depression. And we're going to draw a comparison between past social structures and compare them to the present, and see whether these modern day structures are posing an increased risk in chronic psychological stress. So what is chronic stress? Well, it's been defined as a response to a long-term aversive stimulus. A way to measure this is via the hormone glucocorticoid released from the adrenal glands. And during a stress response, this is one of the hormones that's actually increased, and because it has many effects on the body, we're going to talk about one, you can actually measure stress and correlate it to the level of glucocorticoid. And chronic stress has been implicated in the onset of physical and mental diseases, including things like cardiovascular disease and mental diseases such as depression and anxiety. So we have different types of stress. You have your emotional stress, physical stress, but today we're focusing mainly on psychological stress. And this is because it's hypothesized to be limited to primates and humans. With the onset of psychological stress, they've actually investigated and found that it's possible to reduce it. So in experiments by Cole and Staten, they measured the levels of glucocorticoid, which I mentioned is elevated in times of stress. So what they did in the experiment by Cole is they took squirrel monkeys and placed them in a room, and the stressful stimulus in this case was a snake. So in the first condition, the monkey was alone and isolated, and they found that it had a worse response than to when the monkey was with another member of the troop that it knew. So this phenomenon has been described as social buffering, and it's also been found in humans. So in this cartoon diagram, you find that going through this haunted house here is really scary when you're alone, but when you go in with a friend, somehow it becomes fun. And this is, I don't know, it is a phenomenon, but there are mechanisms to it. For example, physical touch, like when you're very scared, sometimes you hold on to someone, and that tends to make you feel better and cope better with the stressful situation that you're in. So, what we've learned from those experiments is that your actual social environment may impact on psychological stress. But what I need to get across is that there are many factors. We're just focusing on social environment and how it impacts on psychological stress. And if your psychological stress is not resolved, it can become a chronic stress, which we have discussed can actually potentiate to conditions like cardiovascular disease and diabetes. And chronic stress also has effects on the brain. What we're focusing on today is depression. So depression is a mental disease. It's predicted by the WHO that by 2030, depression will become a leading cause of burden of disease. This will be ahead of heart disease. It is very debilitating, both economically and socially. economically, in that if people are not able to function properly, they cannot go to work. So we have less people going to work, impacting on the productivity of your company, and social problems that people will struggle to actually manage themselves and to interact with others. However, some authors have actually argued that the increase is not really significant, because what they're finding is that we're getting a lot more cases misdiagnosed or overdiagnosed, or because of the increase in awareness, we're beginning to detect depression more. But I'm choosing to stick to the opinion that it is actually increasing in prevalence, and it is something we should worry about in the future. So as I said, it's an illness that can affect both mental and physical function. The signs and symptoms include distress, lethargy, difficulty in self-management. There are many possible causes of depression, such as a significant life event, brain changes that are brought about by various reasons. Today we're going to talk about chronic stress. And I've included this logo here from Beyond Blue, because Beyond Blue is the National Depression Initiative, and they talk about raising awareness for a variety of mental health, and they run programs in that to raise awareness. So they've been very good at trying to get the word out about what's going on in society, and they have good information on mental health and how to deal with it. So, depression not only affects how someone is feeling, it's also physiological. So this is a PET scan, showing brain activity. In the left, we see a depressed brain, and in the right, we see a not depressed brain. And what it is you have to notice is that the lighting up in this not depressed brain is showing that there is a lot of activity going on, whereas you compare it to the depressed brain, it's not as well lit up, so this is showing there's not as much activity. This is partially due to the abnormal levels of neurotransmitters, where we find serotonin, dopamine, and noradrenaline are reduced. Also, the hippocampus has been found to be atrophied. Hippocampus is involved in memory, so we can expect that people who are suffering from depression are going to have a problem with their memory function. Also, there's a decrease in the volume of the prefrontal cortex, which is up here. This is an area which is involved a lot in cognition. And although I have said that some areas are not as active as usual, some areas are actually overactive, like the anterior cingulate cortex. Parts of it which are involved in negative thoughts and emotions have actually become overactive. And in some treatments, or in some drug-resistant cases of depression, they found that severing the connections between the anterior cingulate cortex and the rest of the brain have been shown to be good at treating drug-resistant depression. So far, what we've seen is that psychological stress can depend on your social environment. One way of decreasing this stress could be by social buffering. And if we're not doing anything to decrease the stress, we may have a chronic stress, and this will be implicated, and this could be implicated in depression. So what we need to think about is, could our modern day society be increasing chronic psychological stress? Let's start with the journey back to the past. So we have this picture of an old village, I guess, and we found that ancestrally humans have been hunter-gatherers for about 95% of our history. In this picture we can see there are large social networks, lots of cooperation going on, we have extended family around, and to study these past social structures in this modern day, they've been using chimpanzees because they are primates and they're very closely related to us. And what's interesting to notice is that the psychological mechanisms to make this sort of interaction and social cooperation happen are actually genetically encoded and continuously attached during evolution. So it is something that is innate in us to want to do. But what we see is that in modern day society, there's an increase in globalization. We find a lot more immigration, which isn't bad because people shifting jobs, we're working on better ideas, but at the same time we are breaking up our former structures that we have been used to for most of our history. We're becoming a bit more industrialized. There's a shift from the whole collective thinking to a more self-focused mindset. So we've gone from the whole group to the individual, and we find a lot more nuclear families where people are a bit more isolated from extended families. And also it's been observed that higher rates of depression are seen in modern day societies compared to those societies nowadays which have upholded these traditional structures, such as the Amish people and other community tribes. So my hypothesis is, could modifying our modern day social structures to resemble ancestral social structures help in the treatment and prevention of depression? So currently treatments are medical, antidepressants. Some of these are serotonin reuptake inhibitors that prevent the reuptake of serotonin, which is lowered in depression. We also have psychological treatments like cognitive behavior therapy. That's more of the counseling side. But what they found is that in studies by Hayes, they found that in elderly patients with depression, the progression of the severity of depression was decreased when they had social support around them. And in another small cohort study, bearing in mind the study was small so the results weren't completely conclusive, they found that when patients being treated for depression had an opportunity to go home, they came back and had decreased levels of glucocorticoids, which then correlates with the decreased levels in stress. And with a lot of the recommendations for treatments of depression, not only from Beyond Blue but other sources, you find that they suggest that social support from family and friends is really important in helping people recover. So I'd say that we can, although we can't go back to our traditional structures due to the way the world is going, I think it is possible to modify what we have already into something that would make it more conducive for social buffering. We can work on having more living spaces that are inclusive of people. Like for instance, I live on halls. They try very hard to make sure everyone is sort of in interaction with everyone else because we can't be with our families overseas or in a different town, and they run sessions for mental health session like this session. That's me over there. But interesting, this photo was the setup, but the actual thing, we actually do have mental health sessions. To raise awareness so that everyone around in that community is aware that these things are happening and we need to look out for each other. There are more broader community initiatives like Are You OK Day that happened at Monash lately, trying to encourage people to start a conversation with someone who they see every day, because the people who we're seeing every day are probably more likely to have a connection with us than someone who lives in faraway places, like your family lives far away. So that's what we can do. But so in conclusion, medical treatment is very important, and social protective factors may prove to be important in a better response to treatment. Social buffering can be important in reducing psychological stress. That may be one of the factors for depression and hence preventing the onset. But as I said, there are many complex factors that can lead to psychological stress. There are many factors that can lead to depression. But if we start eliminating the possibility of risk factors, that could possibly help someone who is in the process of becoming depressed. Thank you.
Thank you very much, Chido, for giving a really interesting presentation on how we can use ancient social structures to decrease clinical depression. Are there any questions from the audience? Oh yes, we've got one straight away.
Yeah, I really enjoyed that. That was fascinating. I wonder if you've come across the work of Joseph Gahn. Have you heard of him?
No.
He's a professor of psychology at Michigan, and he works on, he's indigenous, and he works on developing indigenous-based therapies for historical trauma, AIHT. And you might find them really interesting because pretty much it really parallels with what you're saying. His findings and the kind of methodology he's developing has to do with treating historical trauma through community action and through bringing people together and trying to find actual traditions that come from the indigenous nations that he's working with that he can modify to fit clinical practices. So that really seems like in line with what you're saying.
Yeah, because one of the lectures, she was talking about how there's this ongoing debate about what's actually better for treating people with mental illnesses. Should we focus on more into institutionalized care, like more of the hospitals, or should we be heading to more community-based treatments?
Yeah, so you might enjoy reading his work, and he's a very well-known guy. So it's G-O-N-E, Joseph Gahn. It's his name.
Oh yes, we've got one over there as well. I was wondering about the social aspect. Do these social structures, do you think that do they involve like social media, or is that negative? Is that being too self-centered? Like connecting to people via social media.
Oh, yeah.
Do you feel that that would be a positive thing for clinical depression or a negative thing?
Okay, yeah. So with social media and can I broaden it out to technology?
Yes.
Yeah, so in technology, like, yes, sure, you can keep in contact with people through that way, but as I alluded to before, there are actual, like, mechanisms that make social buffering what it is. Like, touch, for example, is one. They talked about how hormones like oxytocin take place in that sort of setting of social buffering, and if you're not physically with the person, it makes it very difficult to get across to actually get that change. Yeah.
I have a question for you, Chido. You proposed a few existing solutions that try and connect modern society to the ancestral structures of society. I'm just wondering if you have any. I'm just wondering about your solutions to the link between these two topics. Do you have you thought of a solution that is able to rectify, per se, modern society to the ancestral kind of society, so that we can decrease the prevalence of clinical depression or the severity thereof?
Yeah, I think a lot of it would do. Maybe it wouldn't really help us at this stage because adults have our mind focused in what it is we believe in our values, but like especially with children who are still learning the social norms of society, I think it's very important to make sure they know that they have someone to trust and to create sort of a safe space for them that they can actually communicate with others and teenagers as well. Because the thing is, if you leave it till too late, you could have the other extreme of it going really bad, where they found that a lot of people who have been involved in perpetrating shootings and stuff have gone with an undetected mental disease.
Okay,
Yeah,
so
it should really start from the beginning rather than just...
Right, so it's kind of like the shootings have happened because those people...
Well, not just because one thing, but there has been a massive amount of undetected mental.
Undetected. Ah, right. I see. That's quite interesting.
Yeah.
Any other questions? Questions from social media? Oh, yeah.
I have a question from myself.
Oh, yeah, sure, go ahead.
So, yeah, I think it's quite interesting talking about, social changes to kind of combat clinical depression. And I noticed you used the, are you okay, as an example. But there's sort of like, I've been reading some criticism about that kind of campaign, like factor industry. And so I was wondering, like, what was, like, did you have any, like, opinions about that, and, like, what kind of social changes you want to see? So, like, you're saying that you think it should happen, like, early on, so is that, like, something that you think should happen, like, maybe in the education system? what we're going on. Sorry, that's a bit vague.
Yeah, no, firstly with Are You OK Day, yes, I have my reservations about it because what happens is everyone just sort of like calls us like, are you okay, are you okay? But I think the idea is for it to go past the actual day and to have people constantly, like maybe not so much in the public space, but privately every now and again taking on each other. And what was the second part of your
I guess like, yeah, what kind of social change do you want to see? So like, so you mentioned something about you think it should happen early on. So I was wondering, do you think you mean like it's like schooling or something? Yeah.
Yeah, I mean, I guess I could work better in school systems. I guess, I mean, I liked in high school when we first started, we had the big sister, little sister programs going on. That's always good because then you're interacting with someone who's not in your family, but they kind of make you comfortable enough to go to someone, whatever you have again.
Any other questions? Nope. Okay. Thank you very much, Rachel. Okay, and we have our second speaker right now, and her name is. Sorry, we can put the presentation up. Yep, that'd be great. Thank you. Her name is Thamires, and her topic is the roles and experiences of PhD nurses in conducting preschool child assessments, a systematic review. Take it away.
I am Thamires. I am exchanging student, nursing exchanging student from Brazil. My English is not that good, so I hope you can at least understand me. If you cannot, please let me know. And I have developed this work with two teachers from the School of Nursing in Monash. And it's a systematic review about the roles and experiences of primary health care nurses in conducting preschool child assessment. And it's what we are going to see today. The results that I have are not completed yet. I am in the final phase of this study, and I will show you the results that we have so far. And to introduce the topic, we choose to talk about the primary health care nurses' experiences in child health care, the scope of primary health care, because in the whole world, nurses have been responsible for conducting child assessment in primary health care settings. And primary health care settings include that structures in the community which are working with the community and trying to prevent and promote health more than working the cure, and as compared with the acute care is quite different because the focus is on prevention and promotion of health. And the early intervention has been seen as a very important fact to prevent worse problems in the future. Even in economic factors has been positive to acting early intervention than trying to fix the problems in the future. And we have seen that nurses has produced a lot of science, a lot of scientific work, and we think that it's important to aggregate this knowledge and show what has been done and which are the evidences and what can be used to support political changes and support changes in public health and to improve the quality of the primary healthcare services and the care for the child in this setting in health. And just to talk a little bit about the background of this study, the concept of primary healthcare is based on the ideas around the preventive model, and the preventive model started to be taught in the later years of the 19th century. And people started to think that social issues are very important to determine health conditions. And the primary healthcare concept came from these ideas, the improvement of these ideas. And these ideas improve along the time, and we have some important conferences around the world to discuss primary healthcare, to discuss preventive model, and to improve the ideas and try to build strategies to act in environmental issues, act in social issues to get good, healthier societies, better results in health. And I'm talking about that because the construction of specific roles and nursing roles in primary health care are related with the ideas around the preventive model and the ideas around primary health care. And it's a specific scope of practice. The health professionals which work in the primary health care, they are always trying to act in prevention and promotion of health, and they are always working with community and with in partnership with people to promote empowerment, enabling them to take care of their own health, and to make this kind of actions which are very close to people and to focus on prevention and promotion. And in child health care, in primary health care, the work developed is the same in the primary health care as a whole, but it's focused on the child and focused on the surveillance of the rural development of the child, focused on promoting health development. And the work with child in the scope is not focused just in the child. You need to include the family and the community also, because the environment with the child is working is very important to the development of the child. So always include the family, the caregivers, and the care also. And we choose the preschool children to talk about because it's a distinct phase of development. We know that between 0 to 3 years, it's a neurological, very important phase. And it's an important phase to build a link between families and the primary health care services and the professionals. And it's important to detect risks and vulnerabilities which the child can be facing and act related to this. Our research question is, what are the roles and experiences of primary health care nurses working with preschool children? And our objective is to identify, summarize, and synthesize the evidence on the roles and experiences of primary health care nursing of children into the school age. We chose a systematic review to develop this study. A systematic review is a little bit different of a literature review. Systematic review has a method to find the best evidence about something. It's a very used method to test the best normally health evidences, health interventions in health, as the efficiency of some intervention be tested by systematic reviews, because not by the systematic reviews, but systematic reviews aggregate the production, the scientific production which there are, and appraisal is made some appraisal about the quality of the study, and then is shown the best evidence based on the scientific material that there are at the moment. And systematic review, we have chosen to develop this study to find the best evidences about the roles and experiences of primary health care nurses taking care of the children to the school age. And there are the steps to develop systematic review. We have to choose the population, intervention, and the context, which will be looked at. The search strategies to look at the databases and the further sources which can offer the scientific material. The exclusion and exclusion criteria to apply to the material, and the exclusion and inclusion criteria according to the methodological quality, and the extraction from the studies about what can answer the research question, and the synthesis, which will show which can be synthesized from the studies and show the best evidences. For this study, we have primary healthcare nurses as a population. Often one phenomenon of interest are child healthcare, preschool age, and the contexts are preschool, community, and primary healthcare center. We have some our inclusion and exclusion criteria. We are not including reviews and opinions studies because they cannot offer scientific basis, so they are important also. Our search strategy is including the Single Medline and Focus databases because they aggregate the knowledge around primary health care. The period is between 2007 to current time, because in 2007 was done the last study about the roles and experience of primary health care nurses in this area. there were literature, some studies about some public documents and HW, and which have chosen some keywords to apply from the databases to find studies. We are considering them synonymous and possible same ways to call some things to explain research. And we have chosen the John Grimm's Institute model to appraisal or the studies according to the methodological quality. It's an institute which offers some tools for appraisal studies according to the methodological quality, and we are using the tools from the GBL model to appraisal or articles that we found in the searches. And up to now, we have some results which have shown that nurses have shown important role to act related to child risks and vulnerabilities, mostly in the scope of the family, in the context of violence or context of problems of attachment between parents and children, and to develop parenting skills and act in the child promotion and prevention of the health at all, developing many kind of actions. We hope that the results of this study can support some recommendations for policy and practice of preschool child assessment by primary healthcare nurses, about education and training of primary healthcare nurses for child assessments, and maybe support for the research in the area of primary healthcare nursing groups.
All right, great. Thank you very much for giving a very good introduction on a systematic review on primary healthcare nurses and how that might apply in child health. Are there any questions for this presentation? Yep, Chido?
Yeah, so with like the nurses, would you recommend having like a family nurse? Is that sort of like a feasible thing to do? Like, you know how you have your GP who you go to all the time, like if you're sick, would it be better to have like a family nurse?
Yeah, actually we are trying to reach knowledge purposes in the whole world. So we have some places that we have visitation for by nurses which go at homes and make this kind of things. There is some places in the world this kind of nurse which maybe in some places with doctors, also with another health professionals, and we go direct to the homes and make this kind of actions.
Yeah.
No.
No, that answers, yeah. So like it's different because like we're like in one of my subjects we're talking a lot about how the GPs have like a big role in primary health care and looking after families, but from what you're suggesting is that nurses can also have that big role in like the family, like taking care of the family.
Yeah, depends on the place. As the country that I'm from, we have one whole kit, the whole, and then we have like psychologists and doctor and nurse and physiotherapist sometimes, and they this whole kit take care of the family at homes and make visits and some kind of things. Depends on the needs of that family. Maybe sometimes you need a nurse and another time you need a doctor and sometimes you need a psychologist, and it's according to the needs.
Yeah.
Yeah, I really enjoyed your presentation, and well done doing it in a second language. That's not easy. Yeah, very difficult. I've done it. It's hard. My question has to do with, cultural specificity. Because it seemed like you tried to argue that there were conferences around the world, and there was something that was being done globally along these lines. But it also seems to me that the role, for example, and even the description that you just gave of the way things work in Brazil is very different than, for example, the United States, where home health care is very rare, actually. And also where PAs, physician assistants, are now rising rapidly in numbers because nursing is such a long degree. It takes like 6 years to become a nurse. So I wondered how you see this research being applicable around the world?
I think that is one thing that should be pointed, because probably you're going to see big differences of the rules and what have been done in different places. But unfortunately, I have seen a lot of studies coming from the same places. So I think that nurses have developed more in some places than the other places. And there is a pattern of action, a pattern of what they have done. But I think it should be important that the way to develop public health in the countries are different, and consequently the actions will be different too.
Good. Interesting.
Any other questions? Yep. I have a question. I'm just wondering, are you also including any quantitative measurements in your systematic review, such as statistics or numbers?
Yeah.
Okay. Oh yeah, sure. What are you going to be measuring in your systematic review?
This systematic review is method one. We can do qualitative one and quantitative one. This one is systematic one. We are considering qualitative studies and quantitative studies. And we are going to try to synthesize the qualitative evidence and one group, and quantitative evidence in another group. Although the quantitative studies, I think, are just 3 or 2, testing the efficacy of some treatments and some interventions in the development.
Right. And what are the studies describing? I'm just wondering about the case studies of these quantitative studies that you have available. Where are they? So in terms of what countries are placed, what they were investigating, and could you actually combine these quantitative studies into one systematic review? Sorry. Just to reiterate, could you describe to me the quantitative studies that you have currently? Yeah.
I can't remember exactly which ones, but most of them are trying to evaluate services or evaluate interventions.
Okay.
And they try to, and numbers show if some interventions it has been good, it has been efficient, or if it's not efficient. And the numbers are talking about the services. If some families are treated by the health visitor, that is a health visitor if the visitor has been efficient or not. I don't know if it is.
No, that's fine. I'm just wondering if you have actually considered reports from government agencies around the world in your systematic review. Because from my perspective, it seems like it's a scarcely researched area, primary healthcare in child health. So have you actually researched the government reports to get those statistics? Or
not actually. We are going to see the documents just with offer some scientific basis, not just about the numbers of services or something like that. So we are looking for these documents if they offer the scientific basis from the interventions of nurses in child healthcare and primary healthcare. So I haven't found anyone so far. So I'm looking at the apps to see if I find it. But I didn't find anyone.
Okay, well, good luck with finding out those articles. Any other questions? Social media? Any questions? No?
All right, I do have one more.
Oh, yeah, sure.
Sorry, you got me thinking with your response. Do you think women play a unique role that's different than men in this kind of care that you're describing?
I think we have more women than men doing, but I don't know if it's different.
So if you had male nurses, it wouldn't matter, do you think, the kind of care?
I'm not paying attention to this.
The gender?
Actually, yeah.
Seems important though, right?
Yeah, but yeah, it seems important, yeah. But I'm going to pay attention.
Yeah.
Thank you.
Yes.
Okay, we'll probably end it right here. Thank you very much for giving a really informative presentation. Okay, and that's about it for this session. So basically in 50 minutes time we'll have dinner, which runs from 7 p.m. to 7:30, and then we will have the closing keynote address by Professor Andrew Coates from the Monash Warwick Alliance, which will run from 7:30 to 8:30, prize giving afterwards. Thank you very much for attending this session.
Nicole,
Oh, the other way.